Hello, welcome. Our guest on today's show is Mr. George Demiotis. Mr. Demiotis is a licensed professional counselor practicing in Indiana, Pennsylvania for the past 5 years. Mr. Demiotis has experience treating individuals of all ages that suffer from a wide range of psychological diagnoses, including depression, anxiety, and substance abuse. Mr. Demiotis is here today to discuss some of the big mental health challenges that affect particularly college students these days, and hopefully provide some insight for those who are currently suffering and potentially looking for help. We're lucky enough to have him here in the studio with us today. Mr. Demiotis, how are you?
Pretty good. It's great to be here today.
Great. Well, thank you for being here.
Thanks for having me.
Yeah. Why don't you tell us a little bit about your background, your experience with therapy, and what brought you to Indiana?
I got my bachelor's degree from Florida State, and then I worked at a rehab place for around 6 months, and so that was the beginning of me, being involved with substance abuse counseling. After that, I went to Purdue and I got my master's in mental health counseling. In 2006, I graduated from there, and then I worked as a substance abuse counselor for around 7 years with dually diagnosed people. Dually diagnosed meaning mental health issues and substance abuse issues. After that, my wife got a job at IUP, so we moved here from the state of Indiana to Indiana, PA. And since then, I've been working with kids as a mobile therapist. And then I also have my private practice that is based in Indiana here, which I accept people from all ages and backgrounds.
Great.
Yes.
So, mental health issues obviously affect everybody. And college students are, affected just like everyone else. Do you see college students seeking out treatment and getting help at the same rate that other people in the population are? Do you feel like college students in particular a lot of times suffer in silence, as they say?
Yes, absolutely. I'm glad you asked that. I did some research before, and there's some numbers at NAMI that say 40% of college students do not seek counseling when they need to, actually. So they do suffer in silence, a lot of them. And that goes with, with the rest of the population. There's still a stigma with getting treatment, reaching out, and we have this idea that we can make it on our own, and which is it's far from the truth. Everyone needs help. It's not a weakness reaching out, and part of my work with clients is to build a strong support network, so you can face challenges. Especially in the college environment where, yes, there's a lot of challenges with classes, with schedules, with grades, expectations from parents perhaps, and what we're going to do in the future, and what we're learning now, is it going to be, is it going to lead to a career that is going to be something we want,
Sure.
Yes, go ahead.
No, so I think something that I see amongst my students that I have, and when I hear them talking and things like that, I get this sense that a lot of them do have these mental health, potentially issues that are going on, and substance abuse issues. And I think something that students may be curious about, and I'm curious myself, is how do you know when something is, in terms of substance abuse, let's say, how do you know when you're drinking too much? If you're in college, people are going to drink. People may engage in some drug use.
Right.
When do you know when it is time to actually seek out help? When you do have a problem?
Right. Like you said, it's college. You're supposed to have a good time. With your friends. A big thing you want to think about is when your life is getting, there's a regular routine to your life, when you're starting to when your life is not working out, like when you are not going to classes, when you are, the regular trajectory of your life is off, I suppose. So
if it's getting in the way of your life.
That's a good question. Yes, go ahead.
So if it's getting in the way of the normal things you do.
Exactly, yes,
Okay.
that's what I mean to say. Yes.
Sure.
If it's getting in the way, yes.
So let's give you an example. I hear students say this. Let's say, they say, well, I go to my classes And
Right.
on the weekends, Friday night, Saturday night, I drink. But they're not having 1 beer or 2 beers, and they're having 10 drinks, 15 drinks. But they're still doing their homework. They're still going to class. They're still going out with their friends. But I mean, I don't know if anyone would say having 15 drinks a night, 2 nights in a row, is healthy behaviors.
Right.
Is that a problem? Is that something that someone should be seeking out help for, or is that just college kids being college kids?
Yes, that's the problem with regular adults. You become a functional alcoholic, perhaps. And that can only last that long. You might not be aware of the damage you're doing to your brain or your body, but the damage is there. It's happening. Yes, and it's very hard in college because there's peer pressure. Everyone's doing it. Everyone. It's not a big deal if you wake up and you feel horrible. So yes, when is the limit? That's a good question. Yes.
So in terms of not substance abuse, but in terms of mental health issues, please correct me if I'm wrong. I assume a lot of the issues that college students have deal with depression, anxiety, things of that nature. And again, I'd say, when is it just, something bad happens, you're sad. That's normal. That's a normal reaction.
Correct.
When is it not a normal reaction? When is it time to, talk to someone?
So these things are connected: depression, anxiety, and substance abuse. The more down you feel, the more you want to have a drink, and the more anxious these things are related. So one of the big goals that we do in therapy is that you want to live your life and be able to withstand some things that life is throwing at you, you won't. So that's how you develop some coping skills eventually. So perhaps the people around you can see, because they know you very well. They can say, hey, there's something going on. You're not your regular self. You need to. It's important for you to perhaps seek counseling, or and we do this in therapy. We have to increase the insight you can have. In your life. A person on their own can say, this is getting too far. I'm getting too isolated from my friends. Because there's a lot of pressures.
Sure.
So not getting isolated and perhaps with having regular reactions. Blaming ourselves. One of the big coping skills that I like to promote is having a good positive self-talk. You get a bad grade at school. What do you say? You say, I'm an idiot, I'm stupid. Or do you say, I made a mistake staying up the night before studying so long, so some adjustments in your approach can help a lot.
So if I'm a college student out there, maybe at Indiana, maybe at another university, and I think, I think I want to talk to someone, or I think I do need a little help with this problem or situation. Where do I go? What do I do? What are the steps that I should take if I've never had treatment before, I've never had counseling before,
right.
But I want to?
So if it's a crisis situation, we have the Open Door in Indiana, PA. I don't have the number now off the top of my head, but
we'll post it.
Yes. So a crisis situation, that's one of the best places you can call. So they can direct you to different places you can get counseling and such. Also, another way to get counseling is in IUP campus, the health center. I don't know the details, but when I went to school at Purdue, every student would get 8 free sessions. So that's one way to do it. Also, depending on your insurance, a lot of students have it with their parents still. You can call your insurance provider and they'll give you a list of providers that are in-network providers, like we say. Yes.
How would you describe your style of therapy? So you mentioned a little bit about promoting positive self-talk. If I come in to see you, and this is our first session, what can I expect? I think a lot of people who have never experienced therapy are nervous. They don't know what it's going to be like. Right. What would happen when I come in to see you?
Well, you would show up at my office, and then I have my intake form that I will ask you a couple of questions So the first session is just my intake, just to gather information, to see, kind of get your background, kind of get your history, and we'll take it from there. Some clients come and they know what they want, and they know where they want to take therapy at. Other clients are a little more open-minded, so open-ended, I suppose, with what's going to help them with their lives. A lot of clients just want to, they want me to listen. Other clients, they want me to, give them suggestions, so, yeah.
Would you say going to a therapist is, like buying a car or something? And what I mean to that is, do I try a couple out and see who I connect with? What should I be looking for in a connection with a therapist?
Absolutely, yes, absolutely. So, if you go to a counselor the first time you go, and then you try a couple of sessions, and you get a feeling that you're not getting what you want from them, it's absolutely fine to seek out someone else. It's kind of like reaching out. It's kind of with your friends. You're not going to click with everyone around your circle. So it's the same thing with a therapist. If you're going to click with a therapist, that would be great. If you can't click, no problem. We go to another one. Also, it might be good. I forgot to mention that you can find a lot of therapists online. They're online. They're on Psychology Today, or you can find them elsewhere online. You can see their backgrounds and see, a lot of. I like my background is. I like to talk about a lot of cognitive behavior therapy and mindfulness, and with going from my master's degree, I know a lot of different approaches, but those are kind of my favorites. So if a client is more inclined to go towards those, then we might hit it off more easily than others, I suppose. Yeah.
So when I was doing some research before you came here today, George, I see that you are from Cyprus. You were born and raised in the country of Cyprus. And something I'm curious about is, what does mental health look like in Cyprus compared to the United States? Does it have that same stigma in Cyprus? Is treatment more available? Is it something that people, do more in Cyprus? Or how would you compare the two?
The stigma I think is a little stronger in Cyprus than here. People reaching out and seeking help for their mental diagnosis, yes, it's a little stronger, the stigma from Cyprus.
Why?
That's a good question. Because it's again this idea of we can make it on our own, and perhaps there's this thing called individualistic cultures and collectivistic cultures, and it adds up that in Cyprus if you have a problem, you can go to your family and you can go to your friends. If you go to a therapist, that means you're crazy or there's something wrong with you. So I think that idea is a little stronger in collectivistic societies compared to here, where sometimes I can see from my clients too. If you have a problem, you go to the doctor. You have problems with your stomach, you go to your doctor. You have problems with whatever, and then also a therapist can be part of that whole umbrella of services, and it's more natural for people to go here. And there's still a lot of stigma as well here, but yeah, I think, yeah.
So we talk about this stigma, and there's almost this thing where, since I can't see it, you can't see mental health. I can't see that there's an issue, or substance abuse.
Correct.
People can just say, well, just stop doing it, or just be happy. But it's not possible. But it's not possible to do that. But the fact that we can't see it outwardly, like a broken bone or a cut, or an illness, that it doesn't exist. So how do we start reframing that conversation? How do we start? It's easy for us to sit here and say, you shouldn't feel ashamed, or you shouldn't feel this way. Right. But people still do.
Right.
So what's it going to take to change that?
That's connected to what we just talked about. I think partly is that going to therapy is, some people will go because it really disturbs their lives. Other people, they just want to. They have in the substance abuse world, they say they haven't hit rock bottom, you know. So I can go to therapy to just, you know, learn things about myself and just strengthen my coping skills, you know, and I don't have to be in dire straits to seek help, you know. So yeah, promoting good mental health and strengthening our coping skills is very important, because you're number one. You have to take care of yourself, you know.
Sure.
Yes.
So in America, we have seen states increasingly legalizing marijuana. First medically, and now recreationally. And I think Canada just this week has gone to recreational marijuana being legal, just this week in Canada. What do you think, as a substance abuse counselor, of recreational marijuana legalization?
That's tough to say, because from my substance abuse counselor days, it's not about the substance, it's about the behavior of the individual. So when I used to work at the rehab place, there were people that they were addicted to heroin, and then they went to rehab, and then they were good for a while, then they got addicted to vodka, you know. So it's how your relationship with the substance, that's what it's all about. So when you have a problem with drugs and alcohol, that's probably not good to be legal in your state, because it becomes more of a temptation, you know, becomes more of it's more accessible to you perhaps. So, but I can see someone that has problems with marijuana will say, hey, it's legal now, so, you know, I'm okay, I won't have a problem with it. But yeah, we have to take that with a grain of salt.
But what about, you know, if I'm sitting here saying, look, alcohol's legal, right, cigarettes are legal. Yeah. As we know, alcoholism is a huge problem. And if I say, well, just because you have a problem with it, why should we all have to abide by those rules? Where all these other things that are gambling, all these other addictive things,
correct,
video games even, I believe there's been a huge increase in video game addiction, you know. So why should marijuana be illegal?
Correct. It goes back to the individual. You have to, when you have addiction issues, you know, at some point there's got to be some responsibility from the individual to seek out the treatment and seek out support, and yeah, it has to come from your own. I'm going to say also with marijuana, there's been some studies that show it's good with kids with autism as well. So yeah, with whatever it is, there's 7 things that people with tendencies to addiction have. You know, it's shopping, it's video games, it's sex, it's drugs and alcohol. I didn't do the 7, but yes, there's a lot of them. Yes, so we have to be mindful of those things, and yeah, because a lot of people, you know, have the ability to contain their, you know, they have the ability to not indulge. So yeah, it's absolutely, you know, you have to take responsibility when you have addiction problems, though. Yes.
You mentioned earlier that, you know, when I asked, when is it a problem? When do you know when it's a problem? One of the things you said was, you know, maybe your friends notice, your family notice that you've changed, and they can step in.
Right.
So let's say that I am someone who, maybe I don't have a problem myself, but I notice my friend or my family member, and I think, you know what, this is a problem. How do I approach them? What's the best way to approach them with that? Because I imagine sometimes it's not going to be a fun conversation or something they want to hear, or something that they're willing to, you know, admit. So what's the best way to approach that?
That's a very good question. Yes, the friend of someone that might have a problem, he can call a counselor and get some advice, and perhaps that's one route, to call a counselor and then talk to your friend. Hey, you know, would you mind going and seeing someone? And then you can go with your friend. Or your approach needs to be tactful, for sure. It has to be, try to be as non-judgmental as possible, and kind of have also unconditional positive regard. These are terms that come from my person-centered approach in therapy. So yeah, try to be as non-judgmental as possible when you approach the person that has a problem, you know, and try to develop it. In therapy, we call it a therapeutic relationship, you know, try to, you know, yeah, the non-judgmental is a big thing. Because a lot of times a person that has a problem with depression, anxiety, or substance abuse, or any of those, they know that it's very obvious in their minds probably that. So yeah, we have to be tactful approaching them, because yeah, it's easy to, for them to feel worse about it, if we are, kind of willy-nilly with our approach.
So what do we do if we have a friend who has a serious mental health issue, to the point that we think they may be suicidal, they may hurt themselves, and we think it could be imminent? What do I do from the outside if I see that happening? Who do I contact? Who am I allowed to even contact?
Calling the crisis line is a great idea. Absolutely.
Even as the friend, not as the person doing it?
As the friend,
okay.
Yes. I think as a therapist, I have a duty to report whenever, let's say someone comes and and they talk to me about suicide. I have my suicide assessment that I have to do in my head, at least, does the person have a plan to do it? How does he have access to weapons, or pills or whatever? And has that process started, So perhaps if you're not a therapist, you can do something similar, like try to talk to the person a little more and see if it's a cry for help, how strong it is, how close, have they done things like that in the past, So I don't think it's if you have a good relationship with the person, their parents, like calling, anyone, and, reaching out, and in order to prevent something bad from happening, it's not a bad idea. And even though if the person, you might hurt their feelings perhaps, but you feel like this is serious, we have to do something about it.
If I call the crisis hotline and say, my friend, I think they may kill themselves, I think they may have even the means to do it, and it could happen, what will they do? What will happen then?
That's a good question. Depends on the person that works there.
Okay.
I don't work at the crisis line here.
Okay.
But they would.
Is it ever appropriate to call 911?
Yes, absolutely. You can call 911.
Okay.
And I assume that when you call 911, they have people trained there to reach out and that have mental health background that will take that call. I know there's programs with the police. My previous job, because I worked with a population that got in trouble with the police a lot, and so when someone had a psychosis episode, or someone had suicidal tendencies, or they were in the process of killing themselves perhaps at home, the police would send some people that received training to deal with that. So yes, the person at the crisis line will assess the situation as well. Yes, and I can't give you a straight answer on that.
It's okay. We'll provide all the information
sure.
After our talk.
It's a case-by-case thing.
So you've been here in Pennsylvania and Indiana for 5 years now. Have you found that the problems that people in this area are dealing with, that are facing the mental health challenges, any different from the ones you experienced in patients prior to coming here in other parts of the country? Or is it?
So my role as a therapist was different. I was a substance abuse counselor for 7 years in the state of Indiana. Drug-wise, I suppose, I worked with a lot of people that had the big thing when I worked there from 2006 on for 7 years. It was crack cocaine. There was a lot of my substance abusers that were, where here, I guess their heroin epidemic is a little stronger compared to that. I'm going to say it's similar, both states. A lot of people have anxiety, depression problems, substance abuse. So yeah. Mm-hmm.
So if you, our last question for the day, if you were speaking, to a group of college students, even a group of kids, a group of adults, anyone right now, and you had one kind of parting message for them in terms of mental health or substance abuse or anything, what would that be?
Taking care of yourselves. Okay. It's very important to be compassionate with ourselves. One of the big things I mentioned in therapy is that if a friend of yours comes to you and he's doing very poorly and he's very critical of themselves, how would you approach it? Would you be more critical? Would you be more, would you be harsh towards them? Probably not. You would approach them with some compassion and support. And why don't we do that with ourselves? It's very important to be ourselves' best friend. And so cultivating some of that is very important.
Great.
Taking care of ourselves. Yes.
Great.
Do that.
On that note, George, thank you so much for coming in and talking to us today. And like I said, we will provide all that information that you spoke about today. And just want to thank you again for your time.
Thank you. It's good to be here.
Absolutely.
Appreciate it.
On that note, I'm Dr. Stephen Kleiman, and on behalf of our director today, Mr. Matt Humphrey, I want to say thank you, and we'll see you soon.